There are several aspects that can make a significant difference in the success of cancer treatment. Firstly, most people with cancer don't have access to a comprehensive oncology care program. The frequency and quality of the treatment they receive are also determined by where they live. Some remote or rural areas lack the specialists and support services necessary to deliver high-quality care. This presents challenges for patients who need access to treatment, as well as healthcare providers who face logistical issues such as travel times, availability of transportation, and hours of operation. In this article, we take a look at some key factors that can have an impact on your oncology care. Read on to learn more about what you can do to improve your chances of getting successful treatment and a better outcome from your cancer treatment program. The proximity of the cancer treatment facility to your home is one factor that might determine the success of your treatment. You will want to choose a nearby facility if you have a condition like liver cancer that requires your treatment to be close to your home. The success of your treatment will depend on the availability of highly specialized equipment and staff at your location who can administer your therapy. You may also have difficulty getting your medication if the treatment facility is located far from a pharmacy that stocks your medication. Luckily, many cancer treatment centers are located close to major cities and population centers. For example, many cancer treatment centers in California are located within a few hours' drive of major cities. This makes it easier for patients to get to the treatment center and to get access to the specialized care they need. A comprehensive oncology care program encompasses all forms of cancer care, including physical therapy, oncology nursing, radiation therapy, and chemotherapy. The program should be comprehensive enough so that each individual patient receives all the services necessary to ensure comprehensive care. Unfortunately, many cancer centers do not have the resources or expertise to deliver comprehensive care. A comprehensive oncology care program provides many services, including medical oncology. This includes diagnosis, treatment of underlying conditions, and monitoring for possible side effects from cancer treatment. Hematology. This includes blood tests to check for cancer and other diseases. Hematopoietic support. This includes blood transfusions if the cancer treatment causes your own blood to become too toxic for the body to process. Gastrointestinal support. This includes assistance with managing nausea and vomiting caused by chemo and radiation. Palliative care. This includes discussions with your oncologist about end-of-life care options, palliative care, and hospice services. Many cancer patients are interested in implementing complementary therapies in addition to standard care. Complementary therapies are treatments that can be used alongside standard cancer care. For example, patients might try acupuncture or yoga as stress relievers to improve sleep. You may also try supplements or dietary changes for better health. Alternative therapies, on the other hand, are used as replacements for standard cancer care. Some people might use alternative therapies alongside standard care. For example, some people might use aromatherapy instead of medical treatments for nausea and vomiting. Some complementary and alternative therapies that have shown promise in studies are herbal therapies. These include ginger, garlic, and turmeric. In studies, these herbs were shown to have anti-inflammatory effects, which are beneficial in cancer. Probiotics. These are beneficial bacteria that help your gut microbiota. In studies, these bacteria were shown to help with digestion and anti-inflammatory effects. Mind-body therapies. These help people manage stress and emotions, which are key factors in cancer treatment. Energy therapies. These include acupuncture, reflexology, and homeopathy. Nutritional therapies. These include diet and drinking green tea. Cosmetic therapies. These include yoga classes and visual imagery. Transcutaneous electrical nerve stimulation devices. These are used for pain relief. Vibrating beds. These are beneficial for pain relief and relaxation because they send gentle vibrations through your body. Massage. This can help with sleep, stress, and muscle relaxation. Cultural considerations are often overlooked when it comes to planning cancer care. For example, not all cultures are comfortable around blood, which can lead to a delay in seeking medical care. Some other cultural considerations that can make a difference in your cancer care include local support. Make sure you are connected to the community. Find a local support group that can help you cope with the emotional and practical challenges of cancer. Transportation. Finding a way to get to your cancer care appointments can be challenging. Plan ahead and try to arrange transportation if possible. Privacy. Make sure your cancer care team respects your desire for privacy. Make sure your cancer team respects your wishes regarding the sharing of information, and that they don't discuss things like your finances or family situation without your permission. Entering the hospital. You may be more comfortable with your own culture when you enter the hospital rather than the culture of the hospital or cancer care team. Dining, you may prefer to eat with your family in a restaurant rather than in a hospital or cancer care facility. In many countries, including the U.S., it's common for hospitals and cancer centers to offer financial incentives for patients who choose to receive treatment at the hospital or center. These incentives can include free parking and discounted admission prices. If you live in an area where financial incentives aren't available, you may want to look into alternative cancer care programs. If a program charges a fee, consider whether the treatment is worth the cost. The success of your cancer treatment program is also determined by the amount of research funding allocated to cancer care. With this funding, cancer researchers can identify new, effective treatments. Unfortunately, not all countries allocate funding to research to find new treatments. In these countries, less funding is available for clinical trials, which means that fewer drugs will be tested on patients. Find out if your country has the investment levels that are necessary for the advancement of oncology care. These are only some of the factors that can make a significant difference in the success of cancer treatment. A comprehensive oncology care program, access to a nearby cancer treatment facility, and access to research funding are all important factors that can affect your cancer care experience. These factors can be difficult to find in some areas, but it is important to make an effort to find them. Here are several aspects that can make a significant difference in the success of cancer treatment. One is choosing the right therapy in the first place. The right therapy is one that works, has few side effects, and is suitable for the patient's individual situation. An important factor to consider is whether or not you have tried other treatments before and what worked and what didn't. If possible, it is best to start with the least invasive therapy first and proceed from there if necessary. It may be worth it to try alternative medicines along with conventional ones, as many studies have shown that using complementary therapies can help with recovery. Another thing to keep in mind is how effective your treatment is. This is of particular importance if you are undergoing a combination therapy or if you are having difficulties with your treatment. It is also important to know how long you will be required to be on medication, or when you will be able to resume normal life activities as soon as possible. This will allow you to plan ahead so that you can get back home as quickly as possible after treatment ends. Finally, it is important to eat a healthy diet while undergoing treatment. By doing so, you will not only prevent yourself from experiencing more serious side effects, but also help your body recover faster and better overall. There are several aspects that can make a significant difference in the success of cancer treatment.